Action Team System Exploration session. So that's PA and CAT and GSPAN. You'll hear us using these acronyms. And we've got a couple sessions for this topic specific group, and you'll hear more about what GSPAN is and who we are and what we're doing. And this is the first of two sessions, so we'll have one today and then another one in a month on March 19th, where we will continue this conversation and continue to explore the systems that we're working in to promote physical activity. And we're looking for alignment across those systems as we continue to ramp up our CDC funded work. There are others in the state also with CDC funding. We'll hear more about that. But this today is really about strengthening relationships and growing the understanding of the systems that our GSPAN project seeks to influence. And I didn't introduce myself. I am Jimmy Dills from the Georgia Health Policy Center at Georgia State University. We are the prime awardee for the State Physical Activity and Nutrition Award from CDC, along with several other partners, including Health Empowers, represented by Jennifer Owens here today for physical activity. But a lot of you are on, a lot of you have been to some of these other sessions. This one is specific to the physical activity world. And over these two sessions, what we want to do is connect folks and reconnect with potential members of these community action teams. And we recognize it's a little vague right now. We are still defining exactly what membership of these groups looks like right now. You all got invited to this based on a large distribution list of existing and potential physical activity partners and other topic area partners. And for right now, this is what the community action or collaborative action team looks like. As we move further with the project, that group will probably get a little more formalized and maybe a little smaller. So we just want to make sure people know that you're not signing up for anything long-term by being here today. We just want to learn from you today and learn with each other. And there are going to be various opportunities to participate in this work going forward. And we certainly would welcome and would love for you to be a part of one of the more formal action teams as we go forward. But please don't feel like that's what you're signing up for by being here today. We appreciate your time to just be with us for these couple of exploratory sessions as we move towards getting the work more formalized. Our other goal is to grow an understanding of the GSPAN project. So what are the CAT teams? How do they work? What are we doing? We'll give you some broad overview information about that. And then what we're really doing with most of our time here is exploring parts of the system that influence physical activity in Georgia, the different systems. And physical activity is pretty broad. A lot of different systems impact that type of public health outcome. And that's what we're here to talk about today. We're going to use a tool called whole systems mapping to do that. So we'll spend a lot of time in that. And that's where you all will have a chance to share your work. We ask you now, as you're coming on, if you want to pop in the chat, your name, organization, and what makes you passionate about physical activity. Why are you doing this type of work? And at the chat, that would be great. And then our fourth and fifth goals really start to become more clear in the second part of this. But we're going to be defining key indicators for our evaluation plan that we're responsible to CDC for, and prepare for participation in statewide system convening at the end of April. That is also, like the CATs themselves, still being designed. It's still being figured out, the details of that in-person meeting in April. And we're hoping to get as much detail to everyone as quickly as we can as those details become more clear to us based on the participation in these sort of preliminary systems exploration meetings. And that figure there at the bottom of the slide is just sort of meant to show a little bit of that sequence. So we're exploring the systems, we're learning about the systems, we will be moving into modeling and mapping them in various ways, and then using those maps and models to find leverage points and action, and opportunities for us to really collaborate going forward over the next several years under the SPAN banner, and even more broadly in Georgia as a group of folks working together to improve health across a lot of angles. And so the CAT specific engagement, that's the part one that we're in now, and part two in March. That's where we're exploring the system, learning about each other, learning about the elements in the system, doing a little bit of light modeling there. And then as we move towards that full state in-person convening in April, that's where we're going to emphasize more of the modeling and mapping and get into that space of finding those action points based on what we learned from those maps in the system engagement process. So please trust us. There's a process, there's an arc to all this that we're moving towards, and we look forward to moving along that arc with everybody. So today we're really focused on who's in the system and what are they up to. We're going to give the welcome overview. That's where we're at now. I'll introduce some basics of systems thinking so we're all kind of on the same page there before we move into using the whole systems mapping tool. That's the application of it. We'll be talking about each of us, our organizations as elements in a system, and what are we doing around physical activity. And that's the full group share. So that's where we'll get to hear from everybody. Hopefully we've got, let's see, 29 folks on right now. So we should have plenty of time to do that. And then at the end, we'll talk a little bit about planning for part 2, a little bit of housekeeping stuff, answering any questions you have about the process as best that we can right now. And then that'll lead into part 2 in March, which is going to be more about the measures and mindsets. And so that's where we're going to really start thinking about, in addition to this question here, why are you passionate about physical activity work, but really thinking about what are the mindsets you're bringing into these types of collaborations, this type of physical activity promotion work. And then we'll be translating those mindsets into some measures and start thinking about what do we want to look at in terms of indicators for our evaluation, for our impact, and then moving towards those opportunities for action, setting up the meeting in April. So I know that was a lot, but today, for the next couple hours, we're really just talking about systems, who's here, why are we here, what are we doing, and hopefully all getting a little bit on the same page there. So who's in the system, what are they up to? And also want to acknowledge that our fearless leader, Debbie Kibbe, is out dealing with some family issues right now, so she's not able to join us today. And I know she regrets not being able to be here, but we are moving forward. Moving forward anyway. And Christina Bernhardt, my colleague at the Health Policy Center, is going to give an overview of the GSPAN project for everybody. Christina?
Hi, everyone. Good afternoon. I think I see some familiar faces. I'm starting to learn everybody across these different strategies, so it's nice to see you all. And for those who don't know me, I'm Christina Bernhardt. I'm a research associate here at the Health Policy Center. And as Jimmy said, Debbie's out today, so I will do my best to commandeer and fill her shoes, though those are very large shoes to fill. So just to give a little bit overview of the GSPAN project, the State Physical Activity and Nutrition Project, we applied for this award back in April of 2023. We hosted 2 different sessions for just planning for this application with many partners that are on this call and on other strategy priority calls as well. And we requested the max amount that we could request, which was about $1.27 million. This is a 5-year agreement that we were notified about in July, and we were awarded $888,000. So not quite the max that we requested, but interestingly enough, and I know Debbie mentions this when we have this conversation, every state that was awarded the SPAN project or SPAN award was given the same amount. So interesting to think about when you think about the scope and span of some of these states. We submitted our final year work plan, year 1 work plan and budget back in November of 2023, which was revised in January of 2024. And pretty soon we will be ramping up for a reapplication for year 2 in April of this year. So this is a grant that we have to reapply for each year. Next slide, please. So something that's really interesting for the state of Georgia is Georgia received, I think Debbie says Georgia is the only state that received all 3 awards from the CDC. So the SPAN award, but also the High Obesity Program, or HOP, and the Racial and Ethnic Approaches to Community Health, or REACH, which gives a pretty big impact, financial impact for the state of Georgia. So just over $5.7 million per year across the state from these awards. Next slide. So GSPAN has specific priority topics, and a lot of these are overlapping with some of those other awards. So those priority topics are obesity prevention and farm to early care and education, breastfeeding, nutrition, and physical activity. Some of those topics have sub-strategies. So nutrition has two, physical activity, the focus is on connectivity. Next slide. So we have collaborating partners across all of these priority topic areas. And Jimmy mentioned earlier that Health Empowers. Jennifer Owens is our collaborating partner for the physical activity strategy. We're also partnering with Quality Care for Children for the ECE strategy, Monica Griffin. For the breastfeeding strategy, we're partnering with the Georgia chapter of American Academy of Pediatrics, Claire Eden. And for nutrition, we're partnering with Children's Healthcare of Atlanta, Strong for Life, and Wholesome Wave Georgia, Wendy Palmer and Will Sellers to co-lead each of these strategies. Next slide.
You want to share the GHPC leads on there too?
Oh, yes, I do. Thanks, Jimmy. Jimmy will be the GHPC lead for physical activity, so he'll be your point of contact for anything that's PA related. Debbie will be taking over obesity prevention and farm to early care education, as well as breastfeeding. So when she's back in the office, she will be your point of contact. You can contact Jimmy or I for either of those in her absence. And for nutrition, I will be the lead for the GHPC side of things. There you go. So in addition to these priority topic areas, there are also three overarching topics that GSPAN partners will be tackling within this project. That includes health equity, communications and marketing, and evaluation. So for health equity, our collaborating partner is the Georgia Department of Public Health Health Equity Initiative. GHPC is already in place working with them. And we'll incorporate that, that subject matter into this project as well. For communications and marketing and evaluation, we are partnering with Karna, which is represented by Ken and Molly, to help guide some of these overarching topics for this project. Next slide. So CDC does have some evaluation questions that are guiding our work, and we'll talk very briefly today about the priority area specific for physical activity, but these guiding questions are really focused on policy, systems, and environmental change. So the first one is, how have state level policies and activities affected local implementation to improve healthy eating, physical activity, breastfeeding, and ECE outcomes? The second is, how have health equity approaches been prioritized at the state and local level? And this is really where those overarching principles, equity, communications, and evaluation, will be interwoven into each of the priority topic areas as we go through this project. Next slide. So looking specifically at physical activity, we won't talk too much about this today, but we did want to get this in front of you. We'll go into more detail about it in session 2. But physical activity has a couple milestones and a couple performance measures that have been set forth by the CDC. So the first milestone is to review the community's design for a physical activity landscape in the state of Georgia, or the community of focus. The second milestone is to develop at least one community design active people healthy nation action plan that includes policies and activities beyond community design to address these concerns, these PA concerns. Performance measures are going to be how we track and measure the impact of what we're doing. So that'll be based on the setting reach and the population reach. So setting being the number of new or enhanced policies or plans for systems change adopted by community design, and the number of policies or plans for system change for which visible action has already taken place. And then the population reach is the piece of the number of people living within the geographic areas with that new or enhanced policy or plan for community design. Next slide. So for work plan year one is really a planning year for the subsequent years of this work. This is a 5-year award opportunity, and so we're really trying to get our ducks in a row in year one so we can really hit the ground running for year two. But the activity goal, the physical activity goal, is to increase policy plans or community design changes that increase then access to physical activity for residents. Go ahead.
Mm, I think that's the last one of the overview slide.
Oh, that's it for me? Okay.
Oh yeah, so that's I recognize the language is confusing on there. That's not just the year one work plan goal. That's the overarching goal for physical activity under SPAN is to increase the policies, plans, and community design. And then we have some specific strategy under that we'll get into a little bit now. But still today we're talking broadly about physical activity promotion, your roles in that. Of course, we would like to start to center around some of the policies that increase that type of access, but do want to give Jennifer Owens an opportunity to come on mic if she's willing to, and just share a little bit about Health Empowers and how they came to this work.
Sure. Thank you, Jimmy. Hi, everyone. I look forward to us all being together in person at some date in the future. I'm Jennifer Owens. I'm the CEO of an amazing organization. Many of our team members are actually on the call. So if you want to wave, that would be great. Health Empowers is a statewide organization. We are turning 25 next year, and we have had a focus on nutrition and physical activity since that time. And we work really in all different kinds of settings, from community to early care sites to K-12 education, as well as after-school programs with an emphasis on promoting direct nutrition education, as well as physical activity promotion. And so we've had a long history of both doing the direct service work, but Health Empowers also has a really strong track record in engaging at the policy level, having been one of the organizations to support the ultimate passage of the Georgia SHAPE Act, the implementation of the fitnessgram, as well as a lot of statewide training around best practices in physical activity and nutrition. So just really, really honored to be a part of this work. I have the pleasure to lead a team that does just a phenomenal job, and I look forward to everything that's going to come as a part of this project.
Great. Thanks, Jennifer. And no pressure for your staff. I know they're phenomenal, so that's not even a big ask for them, I'm sure. So thanks for that overview. And so that gives you a little bit of a taste of the complexity we're working in just as the GSPAN awardees. And we also know there's those high obesity prevention and the racial and ethnic approaches to community health awardees. And I think some of folks from those projects are on here as well. So CDC is really urging us to, and it makes sense that we would try to collaborate and align as best we can with and really maximize the value of their investment in Georgia and chronic disease prevention here. So now we're going to shift gears a little bit and start talking just about systems in general, try to make sure we're all on the same page about, we talk about systems thinking and what that is. So I've got a spiel here, but I want to hear from folks. If you pop it in the chat or come off mute and share vocally, we just hear that. We're talking about systems. What comes to mind when you hear systems in this context? Anybody? Anything come to mind? There you go. Thank you, Ursula. How the operation is performed and the data that supports it. So, yep. So we're thinking about operations or process there. What else? Processes, yes. So systems are often a way we think about different processes and how people move through different systems as a process. What else?
This is Liston with Marta. Just I guess when I think of on the abstract level is just all these different pieces that kind of come together and synchronize and drive change.
Yeah, definitely. And appreciate you guys from Marta being here, because I think that the Marta system, that's a different kind of system that's maybe not a process, but is a system of infrastructure in a way, but also an operational system that has a lot of different parts connected. Thanks for sharing that. Other thoughts?
Happy to be here.
Yeah. Connection of different organizations working together to complete a program. Yeah. All right. One more. Anything else that's not come up yet that when you hear us talk about systems, what are you thinking of? Right. Well, you're all right, because systems are everything. Consensus. Yes. Consensus in the system. And so I always ask that when we start these systems thinking discussions, because a lot of people from different fields, different perspectives, hear systems and think of different things. And you all have been pretty square in that organizational aspect, process aspect, a little bit of the interconnected aspect of things. But sometimes we get folks that think about mathematical systems and models and epidemiology. And I know some of the transit folks, there's transit models out there that model the behavior of systems. And that's really the top of the mountain. We use the systems mountain idea here just to demonstrate that there's a lot of ways to bring systems thinking into our work. And it doesn't have to be building a complex model, because these models take a lot of expertise, a lot of resources, a lot of data to build them well. And examples here are kind of just some epidemiological models that I pulled out. And then the one on the right is the Georgia childhood obesity model that the Health Policy Center and some of the other folks on this call, I believe, helped to build over years with lots of data. And that was able to model different policy options for our state legislature that then helped inform their decision to pass the SHAFE Act and do specific policy options because we had this model to inform them. That's a very powerful tool, but it's not the only tool. You can also find a lot of power in just working with the maps, and that's what we're building towards here. We may get to modeling, in future years, but right now we're trying to build towards this mapping aspect and a little bit of light modeling, I guess. So on the left there is an example of the whole systems map, which is really just a table. That's what we're going to be working on today. In the middle is a visual map of the Georgia opioid system that the Health Policy Center also helped out with. And that was a powerful tool for that group of stakeholders in a similar context to the SPAN and chronic disease work, sort of coming together with different aspects of the system and thinking about what they do, their processes, and how those processes are connected to other parts of the broader system. So very much illustrating these types of connections. And then on the right is a visual of the PRISM model from CDC that just shows another type of map that can be made for systems. And you use these maps to understand the system. These take a little bit of coaching, a little bit of expertise, but really can be done through, there's a lot of powerful tools out there for collaborative systems mapping to work together. And that's what we're going to be bringing to the table over the next series of months in these types of meetings. But the basic part is bringing a systems thinking mindset to the work. And that can just be a series of thoughtful questions. We got the 5 R's there that some we use in maternal and child health world, but I think that came from USAID. The second one there is a 6 questions framework for analyzing policy that the Georgia Health Policy Center put together. That's based on systems thinking. They're very straightforward questions, but just having them there and thinking about those different dimensions of a policy helps you start to think about how it ripples through the system that is our state or our healthcare system or our physical activity promotion system, whatever it might be. And then on the right there is the systems iceberg, is one of my favorite tools to start applying this mindset and getting to some rudimentary mapping. And we'll revisit that a little bit in part 2. So the formal definition of a system from Donella Meadows, a systems thinking guru from early 21st century, I believe, is systems a set of elements interconnected in a structure that produces characteristic results. And there's 3 parts to that definition that all have to be working together. So it's a set of elements. Here we've got a car. All the elements are out there. That's not functioning as a car yet. That's just a bunch of pieces on the ground. And kind of that's what we're kind of doing today, is starting to atomize, really disentangle our current system, see where everybody is, what they're doing, and then start to look at how it's interconnected in a structure. In this example here, all those pieces can be interconnected in a structure. In this case, it produces some nice public art of, I think those are maybe cows and horses. It's pretty, it's interesting, but it's not a car. It's not the system of a car when you think about a car that is, a metal box with 4 wheels that moves people from point A to point B. It's all 3 of these working together to create that characteristic result. So you got to have the set of elements. They got to be interconnected in a structure that produces that characteristic result. And that characteristic result can be good or bad. Right now, I would say for physical activity, for chronic disease prevention in Georgia, a lot of our elements are interconnected in a way that's producing an unhealthy result. We certainly have instances where we're moving in the right direction and we want to elevate and celebrate those. But the system is getting the results it's designed to get. So right now, our system, for good or bad, is designed to get some of these unhealthy results that we're seeing. And that's why tackling this from a systems perspective can help us identify those places where we need to change so we can start to see the events and see the outcomes we want to see. A big piece of this is thinking about the boundaries and how systems are nested within each other. And so keeping with the car example here, the car is a system. There's a lot of subsystems within the car. You got the exhaust system, the entertainment system, the catalytic converters there, all the different subparts of a car, the subsystems within that. And each of those need to be working in a certain way together to make that system of the car work. And in this instance, a mechanic who works on cars needs to understand the ins and outs and the details of that level of the system within the car itself. When you move there to the middle, that's the highway system. That includes cars, the system of cars, as a subcomponent. It's really a broader system of roadways that connects the country and people drive on them. The folks that are working there are your civil engineers, your land use planners. People at that level of the system bring a different set of expertise and a different set of intervention points. You don't necessarily need to understand how the electronic system of an individual car works to be able to engage with highway planning at the largest sense. So there's different types of expertise for different pieces of the system that you're working in. And then on the right is meant to illustrate an even broader view of a transportation system that includes freight movement, rail, biking and walking. This is the kind of stuff we want to be doing with the physical activity work here. But all those are different types of transportation systems working together to create that multimodal system. And that takes another set of expertise. You got to have the people understand freight, understand the rail transit, understand bicycle transit, bike ped transportation. So you get a lot more expertise needed at different levels of the system, depending on what we're trying to do. And so with this work, right now we've got the public health, the broadest system in Georgia we can think of. Today we're trying to think about the physical activity aspect of that. What aspects of our systems are impacting physical activity specifically? And as we work through this project, we will continue to narrow down to identify the specific subsystems we want to be engaging with. No matter what you're working on, it's affected by a system. Systems are ubiquitous in the type of work we do. And very rarely do we get the chance to completely redesign a system from the ground up or start over. Typically, we're changing something about a system to make it work better for the goals that we want to see. And these are two kind of tongue-in-cheek examples of that, where this table, if the goal of that system is to have everybody sitting level to enjoy a dinner and conversation together, that one chair was not working to support that goal. So rather than throw the table out or go to a different restaurant or whatever you might have, somebody thought to just change the structure of the system for that chair so that whoever's sitting there is also able to participate and be level at the table. The one on the right, he needed to alter the system of his bicycle to be able to carry goods home. I don't know why he didn't put a regular bicycle basket on the front of that, but he had a shopping cart. But again, he didn't throw the bike out. He changed something about the structure of that system to better serve his needs. And that's what we want to be thinking about as we move through this work. What are the pieces of these systems that are critical for success, and how can we influence those pieces of the system together? When we do these systems thinking exercises, it really helps tap into our mindsets and other people's mindsets and mental models. So just understanding how everyone's thinking about the system, how we work together. Some folks on here have collaborated together for a long time. Some people are brand new to collaborating with each other. And this is the chance to start to learn how we're approaching these systems and see the whole system as we are gravitating towards those best high leverage points to move action in the system towards healthier outcomes. So doing the systems thinking helps to test that, helps drive us towards that, that type of systems thinking. And the systems iceberg, which will feature prominently in part 2 of this session, is shared here just to show the events or the things that we're seeing and reacting to. But the iceberg is the system. And the further below the waterline, the deeper we go into the system, the more chance we have to change. Those are those high leverage opportunities. And so you start to think about, what are the behaviors that people are doing at a population level? How is the system behaving? What are the patterns? What are the trends that are leading to the events that you're seeing? Deeper than that are the structures. What underpin those behaviors? What are the policies, the laws, the environmental designs? How are things literally structured to support or inhibit specific behaviors? And then the deepest level in this version of a system is the mindset. How do you get people to think differently? What are the attitudes, beliefs, values that people are bringing into this system that are supporting positive change or maybe inhibiting it? And you want to think about, what are some of the mindset shifts we need to be looking out for or moving towards in the long term, But here with our CDC funding, we're funded to do policy systems and environmental changes, or PSE changes, what we'll is the shorthand for that. And so that's really changing the design. That's designing the structure of a system or redesigning it in most cases. And so our main strategy for the physical activity work under the SPAN award is to implement state level policies and activities to connect pedestrian, bicycle, and transportation networks to everyday destinations. So that's a pretty specific piece of physical activity promotion we're trying to get at with our main strategy. So put that in there for context of what we are charged as the SPAN team to influence in terms of structure of the system. But certainly at this stage, don't want that to cut off any discussion here from everybody. If you're doing something physical activity in schools, we want to hear about that. If you're doing physical activity through exercise programs in a community, we want to hear about that too, so we know what's happening in this whole system as we move towards our specific dedicated work to increase the connectivity to these everyday destinations. So we're in the wide space now, narrowing towards this kind of action through the SPAN award. And the other awardees will have other pieces that they're working on under the banner of policy systems and environmental change. So that's the orientation to systems. And now the whole system mapping tool is really just a set of questions to elicit a high level view of the system. The planes there is the 30,000 foot view. What we're trying to do is start to see how we all interact with this system. And the product is a visual or a table that helps us understand that. And we will use that to identify points of overlap, gaps, missing perspectives. But it's really about us all coming together to identify what all are we doing? How are we doing it? And then the next step will be, how do we start collaborating around those things? So again, think back to the picture of all the car pieces. That's what we're doing today, is trying to map all that out and have everybody share what they're doing, what they as an organization or an agency or even an individual as an element in this physical activity promotion system. How do you connect to how do you connect? What are the structure? What are the elements in our structure that we're working in? So in the whole system mapping, the questions don't always need to be the same. They are driven by what we want to understand about the system. And we came up with the questions for our version of whole system mapping here based on what we, the SPAN team, wanted to learn from everybody. That does not preclude adding additional columns to the table, coming up with other questions that we want to hear from folks. Just for right now in the activity today, I think it's about 5 or 6 questions we have. We felt like those were the high level headlines we want to hear from each partnering organization or each organization about the work that they're doing. So each row represents a different organization or agency person. When we get in there, if you guys collaborate, if you're from the same organization, feel free to do that. If you make multiple rows, that's okay too. We're going to come in behind everybody and sort of clean up the map, the whole system map, so we can use it in the next session. So the steps for whole system mapping: setting the boundaries for the system we want to map. That's a little ambiguous. We're putting the boundaries here as physical activity promotion in the broad sense, but I think we'll continue to narrow that down. But for now, we're setting the boundaries pretty broad, thinking about Georgia and physical activity. Then the second step is identifying the type of information you want to collect and develop the questions. That's what the Georgia Health Policy Center and the collaborating partners have already done some of that work. Part 3 is what we're doing now. We're gathering information from a wide group of organizations, service providers, perspectives on the system. We're going to combine it all into a table that we'll use in the next session, and then we'll analyze those results together. So we're kind of doing 3, 4, and 5 here today. And then 6 is planning the next steps of what we're going to do with it. And that, again, will happen offline. Here today, we're really focusing on 3, 4, and 5 to some extent. The equity considerations of this: we don't have all the perspectives at the table today. There are certainly people and viewpoints that are not being included. We want to identify where those gaps are, continue to include them, be it through more whole systems mapping or other means, but we acknowledge that we want to get a wide breadth of perspectives, but inevitably we're going to miss some, and often those are the ones coming from the end user or the community members, kind of the people we're really trying to get to be healthier, to move forward at that direction. So we have a column on it asking, who are some of those local community partners, representatives of communities that you think you might be able to bring to the table through some of your existing relationships. Here are a couple examples. I didn't tip, but we've used this a lot recently with the maternal and child health community to good success on some other work that we're doing. This is an example from telehealth, just a simple one. You got two different organizations, what service they provide, where is that service provided, how are they connected to it, how many people are served. So that's a simple one. And then we were using it with these maternal health folks, as each of them were funded by HRSA to do state maternal health task forces. It was a part of their award. And as the new awardees were coming in, our other center that some of us are a part of, was helping them think through the maternal health system in their states and who are the different perspectives that need to be at the table to build a strong and representative and inclusive task force at the state level. And you can see there some of the questions, some of the organizations we brought in, or that got put into the map. I forget if this is this. I think this is still the example, but this is very similar to what the states actually did, thinking about who are the different agencies that work with maternal health, et cetera, et cetera. So this is what we're going to be doing for physical activity in Georgia. We've done one of these with the other three topic specific groups as well. And so right now we're continuing to work in these four topic specific streams. And part of what we'll be doing in April is trying to combine all this into one really big, really complex system that hopefully we're able to learn from. And Margaret, thanks for popping the link in there. We've got this as a Google Doc. So I'll pull that up on my screen. So this is what you should be linking into if you're able. We know some people can't get to Google Documents for various reasons. So if you're unable to, please, when we're doing the discussion, speak up, share if you weren't able to put anything in the map, or put in the chat your answer to some of these questions that you can see on the screen here. So what we want you to do is find your organization or agency in there if it's on there. If it's not, add another row and think about what are the policy systems and environmental activities that you're already working on. What are you doing in the space to promote physical activity? What geographies do you primarily serve? What are the settings in which you work? What are the specific populations that you may serve through physical activity promotion? And then the questions I was talking about, are there any key community leaders you think you might be able to bring to the table or would want to, and who are they? And then broadly, how do you measure success? This will help us move into some of that indicator and measurement conversation in part 2. But right now, just thinking about how do you measure success? And last bit from me here, just want to keep the goal, our G-SPAN goal and strategy up here of increasing policies, plans, and community design changes that increase access to physical activity. That's really what we're trying to get to specifically by creating those networks to connect to the everyday destinations. And I think we got a lot of the right folks on here to be thinking about those issues. So with that, I'll pause for any questions of process. Otherwise, dive in. We'll take about 5 minutes, populate your rows, and then we'll come back and share. just put in the chat the link again for folks that maybe joined before we or after we stuck it in there, and then the key questions if folks aren't able to work in the Google Sheet. Those are the questions, and we'd love for you to share in the chat if you're unable to share in the collaborative document. We'll give another couple minutes for folks to finish up. Looks like we got some good information in there to discuss. Right. So thank you all for participating and putting some interesting information in there. And now is the time for us to share it. So we'll just go through and ask folks to come off mute, share what you put in the chart. Just be sure to say which organization you're talking about or which row, so I can go to it and highlight so everybody can see it on the screen at the same time. But anybody want to be bold and volunteer to go first?
I'll go first.
Great, thanks, Tina.
Yes, this is Tina McLaren, physical activity specialist at DeKalb. Basically, I'm a year and a half at Georgia Department of Early Care and Learning. I formerly came from California. And so when I took this position, my role is to actually integrate and build the physical activity for early care settings at DeKalb. So last year, I coordinated with the Morse Children's Health through the physical activity learning session training program that's funded by the CDC. So in June of 2023, we trained 22 leaders in the state of Georgia. So within that year, in September, the whole state of Georgia became now a part of the 19 states in the US to be part of the Pulse training program. So within that, we trained 29 participants for EC providers. These are educators in the south of Georgia in Albany. So we trained 29 participants. We use actually the Georgia Physical Activity Assessment Tool. So we have 8 agencies that completed the survey, and we have the data for that. And so from there, this year, DECAL, our nutrition and physical activity team, became part of the advisory committee for the new 4 micro session trainings that we'll be implementing and launching in April for all our train the trainer leaders in the state of Georgia. And that's about it.
Awesome. Can you, I might have been splitting attention and you might have said I missed it. When you say leaders, what can you give examples of kind of what?
Oh, these are leaders coming from Head Start, CHOA, our state nutrition training team, all the community-based and partners in all the state of Georgia. Some of them are from the Farm to EC Coalition. So yes, Health Empowers is one of them too.
Okay, thank you for sharing. That's awesome. And I know that assessment survey tool is something we're going to be looking at as well, and probably building on what you've already put together. So it's great to hear. And we're happy you're on board here and on the other fronts as well.
Right. And at the training that we had for our participants, we provided 6 hours state approved hours for all our educators. So that's now going to be part of our professional development at TCAL, whether it be in a webinar or in-person training.
Great. And so I just want to call out that last piece, is that's an example of a policy, of a system. PSE change is to require that specific type of training for your folks, as you know, they build the practice in the world. Those are the kind of changes we're talking about, is how do we implement them and make them a part of the system. So thank you for sharing that. Anybody else who would like to go next?
I'll volunteer Health Empowers, but I'd love for one of our staff members to speak.
And you got a lot in here.
I know, I filled out the boxes and then you all can add in details.
I can go ahead and
Thank you,
volunteer
Kim.
myself. Hi, I'm Kim Santana. I'm the lead health educator in the early care setting. So super excited to be here and be a part of this groundbreaking work that we're doing throughout the state. So yeah, what we can do is talk about, we have student-run food pantries on site at some schools. And we also have our Girls Empowering Movement programs offered at middle schools. Environmental cues, of course, to encourage healthy eating and water consumption, as well as physical activity. Programs that add minutes of PA opportunities to the day for children. Cooking Matters classes to teach parents and students cooking skills. Increased opportunities for physical activities during the instructional day. Change in practice and policies that afford more opportunities to eat healthy and move more. Okay, and we are basically throughout the state of Georgia, but we are concentrated in some particular counties, throughout the state. Of course, Metro Atlanta, we're in Richmond, Hart, Elbert, Mary, Whitfield, Central South Georgia, plus 30 other counties throughout the state. So we really, have hit the whole state of Georgia pretty hard. We, like Jennifer talked about earlier, we have our early care setting, K-12, after school programs, and our community. And the specific population, of course, are our SNAP eligible centers, sites, schools, and also the middle school girls. And our key community leaders. Of course, we really would really encourage and want superintendents and or school boards, really to be more active in our programs. Of course, all of the wonderful state agency partners that are on the phone today. And then our early care, child care center directors and providers, which does include our family homes. And we measure success through, of course, our trainings, our PSE changes in all sites, and the sites that we work with do provide evidence for all of those PSE changes. Increase in fruit and vegetable consumption, increase of minutes of physical activity, increase in daily water consumption, number of student leaders engaged and leading peers. And of course, our strategic plan KPIs can be shared to see full breadth of what we measure throughout our programming.
So you guys do a little bit, I guess. That sounds like
just, occasionally we, dabble in this throughout, our days. So yes, sir.
That's great. Well, I'm gonna handle one thing, but I'm gonna tee you guys up to, if you can, think on the fly. A lot going on in there, and that's the whole system. Can you talk a little bit more about specifically around physical activity, what you're doing? I think in those settings, I'm trying to work it into how does that connect to transportation networks, getting to schools as an everyday destination, that kind of stuff. So I want to hear a little bit about that, but I'm going to share, because I noticed in the chat, looks like Michelle, maybe some other folks are wondering if you were on one of these earlier meetings and you did this, why isn't it showing up? It's because those earlier meetings were a different sheet for a different topic. So that's that's why you might not see what you, if you participated in an early one. This is the physical activity one. That was the, I forget which one was on the 14th, but that was breastfeeding.
Thank you, Jimmy. I feel like showing up and having it stick is really important to be able to carve this time out. Otherwise, it's like I got to move on. Thank you for that. I
It's
really
stuck,
appreciate
it sticks. It's just in another file that we're not looking at right this second.
That's
So
fair.
you have anything physical activity specific you want to share, feel free to jump in. Otherwise, we know we've got you on the other one. So health empowers.
Yeah,
Okay.
I can speak specifically, for the early care setting. What we do is we provide our resources and training, and we're very intentional about what we're providing as it pertains to physical activity. We have a fit kit that has, I believe it's over 50 physical activities that, of course, align with the Georgia Early Learning Standards. And so we are basically, in our mind is, okay, give these resources, whether they're lesson plans, curriculum, or actual tangible resources. And so basically all the teachers really have to do is, be present and lead these activities with the children. So we don't want to make it one more thing that teachers are having to do. We want them to incorporate it into their daily, life there at the centers and family homes. And then we do provide those model lessons. So we go in there and show those teachers, okay, how easy is it to integrate physical activity, structured physical activity, unstructured, how to be intentional about it, and how you can really include physical activity, even if you're reading a story. So really giving them new ideas, and modeling it for them so they understand really how easy it is. And of course, this is through, we want this to be a part of their culture there at their centers and family homes. So write this into policy. Our children are doing 120 minutes of, structured physical activity, and this is what it looks like. We really, really want to, not have the children where, they're just out on the, playground and the teachers are holding up the fences. So we really want to give them those activities and ideas and resources, and of course, trainings.
Yeah.
That's for the, the early care setting. I'm not sure if any of the other folks on here would want to speak to the other settings.
Yeah, while you think about that, I just want to pick up on what you're describing of giving them these options, giving the teachers. You're not trying to, it's that structural thing. You're trying to bake into the structure of what they're already doing in the classroom, give them other opportunities, other ways to approach it. You're not telling them to stop teaching the way they're teaching now and do something
Exactly
different. You're trying to get the resources in the hands of the right people at the right time in the right space. And that's a microcosm, that's a subsystem of what we're talking about here, of working on our system structure. But Suzanne, I think you were ready to share a little bit more.
Actually, I was going to, and I hate to do this, but there are so many great things going on. So taking what Kim just shared, but having it directed solely by the youth, I was going to ask Adria to speak on behalf of the GEM program, because that is truly all youth generated. And we've got some, I think, wonderful examples of how physical activity is now increased as a part of their world, but it's all youth driven.
Yeah.
Sure. I'm Adria. I'm the program director of Girls Empowering Movement, GEM for short. The program itself was named by middle school girls, and the program is designed for middle school girls. We had a group of youth advisors from across Georgia to develop the program, the concept, and the curriculum for how it would work. It is an after-school program, so it's implemented in schools and their after-school programs, in Boys and Girls Clubs, and in Girl Scouts of Greater Atlanta and Girl Scouts of Historic Georgia as well. And basically the girls go through a curriculum that's based out of a journal. And we also have all of our resources freely available online. And it's designed for girls to create relevant physical activity opportunities after school for them. So we have 2 girl facilitators and 1 adult facilitator at each site. They help go through the curriculum and the program, where the site is able to sort of collectively decide which physical activities they want to try. And then everyone is also trained on adaptive physical activity concepts. So, and that's led by Blaze Sports. And so about 32% of our participants do have some sort of disability or special condition. And it's created so that any middle school girl, regardless of their physical activity level before or after, whether or not they've been involved in sports, whether or not they have any specific needs or disabilities, are able to participate in the various activities. So the girls have tried all kinds of new things, ranging from archery, jump rope clubs, going swimming the first time, dancing is incredibly popular, just getting them to explore physical activity opportunities that are relevant to them. And then also as a part of that, the girls come up with their own Create a Movement project where they expand physical activity opportunities for other middle school girls and other people in their site, whether that's a school or a Boys and Girls Club. So we've had like Boys and Girls Clubs who have created a jump rope kit that they've expanded to like 20 other sites. We've had girls at school-based sites who have integrated 30 minutes of additional physical activity to an hour of additional physical activity during their lunch time or right before their lunchtime, where other people in the school can kind of come in and drop into the gym and have different rotating stations where the girls lead different physical activities for everybody in the school. So it's just been really exciting to see. We've had about 2,500 direct program participants so far, and they've created additional physical activity opportunities that have reached another 12,000 participants throughout the state. So that's a youth-led program that's really exciting, and all of our resources are accessible and freely available to anybody who wants to participate.
Oh my gosh, that is so great to hear and just amazing, and encourage you to pop that link in the chat. I'm sure a lot of folks on here would be interested in seeing that. And I want to call out to further tee up our iceberg work in part 2. And Debbie could give you the better data than me, but I know there were data that middle school girls are a particular group that need, like, the physical activity falls off for middle school girls in a way it doesn't for the boys. And so there was a signal from the system. That event, that data drove us to think deeper in the system about middle school girls specifically. What are their behaviors? What are the structures for them? What are the mindsets they have about it? And I imagine that's all relevant in your work, but that just shows how one data signal from the system that middle school girls were falling behind in the physical activity space precipitated systems action and intervention to structure physical activity opportunities differently for them. So that's a great example from the school setting, and sounds like even broader than the school setting. So really want to applaud that work. And now who has the rough task of following that? Who's got other work that they're doing in the state that they'd like to share?
I'll go. This is Lisa Begley.
Thanks, Lisa.
I'm the Health and PE program specialist at Georgia Department of Education. I just am following, what everybody's been saying, and we are big on policy at the state. I did put in the chat or in the document what our state rule is, and that state rule talks about what all needs to be taught at the state level in our schools. Drugs and alcohol education, disease prevention, fitness assessments, and then that each school, the 90 contact hours for health and PE, which has been a hot topic this year with people feeling like 90 hours, they can't get that much in. So 90 contact hours of instructions, grades K-5. And then providing substance abuse training, and then as well as HB 287, which talks about human trafficking needs to be taught. And then that school boards are kind of have the autonomy to teach whatever they want for human growth and development or sex education. And then about another thing is fitness assessment. That's a way for measurement for us to kind of see where we're at fitness wise across the state. We are working with districts, RESAs, schools, all health and PE K-12. And then again, we measure success on those fitness assessments. And then if those different topics within the rule are being taught.
Awesome. And because I'm sharing screen, I can't jump on Google. What is RISA?
RISA is like kind of like a cluster of districts that are small, typically in rural areas.
What is the acronym?
I think it's like rural education system something.
Oh, okay. Okay. It's yeah. Okay. I get you.
Yeah. So it's like a cluster of small counties or small districts that have the DOE come in and talk to their people,
So regional
district leaders.
education service agencies.
Oh, there we go. Okay. Yes. Thank you. I should probably know that, but I didn't. So I've only been in this position since September, and I've met with like one RISA. So
great. Well, I will ask again and just portray where my mindset, my view is coming from. So anything from Department of Education through this on sort of safe routes to schools, things outside of the school, the immediate
we do bus safety. Bus safety falls under us as well, bus safety training. But yeah, it's mostly just in the schools. And then, you know, we're promoting those 90 hours of getting kids health and physical education time. There's the mandatory graduation credits. Yeah, just having help be taught in middle schools and stuff like that.
Awesome. Thanks so much, Department of Ed, Lisa.
Yeah.
All right. Who would like to share next?
This is Heather. I'm with the High Obesity Program at the University of Georgia. So we have had funding from CDC before for our High Obesity Program. So I largely put the things that we have done. With the previous funding, we have a collaboration, and one of the students who works on that collaboration, I think is on the call, may have had to step away. But we work with our College of Environment and Design faculty and students, and we work on developing, in the previous funding cycles, we worked with 3 of our counties to design plans for either enhancing or building or improving existing space within the county. And that was a process where we worked with stakeholders in multiple layers with focus groups, going actually and doing some observational work and other things. And so for the 3 previous counties, we have created a number of different designs. And from those designs, we then were able to enhance and revitalize some existing parks and playgrounds. In some cases, we were able to put in some temporary walking paths with the county or repair some of their existing walking paths, and then help them with some signage to promote the use of those paths. There's many things that we did, so I couldn't put all of them. I just try to put the large buckets there. We are expanding in year 1 to include Rockdale, but very much in the assessment phase, and ultimately over this 5-year funding cycle work in 10 counties. So I think so we, like we have lots of relationships in our counties. All of our work is done through our cooperative extension service. Those people live and work in those communities, so they have great relationships. We have existing county coalitions in all of our counties that we've worked in previously. And we also have good relationships with like the regional development, the RDC's Regional Development Commission, I believe, and other partners who were key to informing the designs.
So you guys are really working very much in the design and structure and like making these spaces for physical activity conducive to that and the trails to them. So I like the sequence of this, how we've gone from sort of early care to the broader schools to now thinking about parks and the routes to the parks and things. So again, sort of scoping this out broader and broader to try and get the bigger impact. I see a question there of how do you measure success? So project records, and yeah, I think we're asking, how do you know when you've been a success? Is it because more kids are using those playgrounds? Do you measure changes in physical activity? Any, like how would Dooley County say that the HOP has been a success for them?
So we do use our coalitions as kind of like sounding boards and going back to them and asking about the projects once they have been implemented. We also have in the past used community surveys and other things to capture awareness and use of any changes that are made in the county. And there was one other thing that came to mind when you were talking, but it's left me. But oh, so at a local level, we have because we work in nutrition, physical activity, and a new strategy this year is family healthy weight programs. But we have been working with our collaborators in the College of Environment Design to also map locally our counties, like where the food pantries are and the other work that we're doing so that we can get a local map of connectivity as we work on all of the different strategies.
Awesome. And that might, I'm saying this kind of for our notes, that I think that would be great to see and have a discussion with you guys about how have you built that piece of it, that because I think we're doing the same thing, so we should learn from what you're doing out there, or the mapping, and exactly what those maps look like, and do we make a statewide one? Do we try to make something similar in other counties? I think that would be a great connection point between the two programs, among many others.
Hey there.
Yeah.
Before you guys move on, I'm the student working under the College of Environment Design. I'm that connection. So I was in a class where we were doing a lot of this work a year or two ago, and a lot of our mapping was based on like a hand mapping sort of situation where we look on Google Maps and kind of like recreate a graphic representation of that. But it sounds like we're going to move a little bit more toward using software like ArcGIS to have a more accurate depiction of those areas. So hopefully we'll have that to share as we continue on with the project.
It's awesome. And I'll geek out for 1 second and then move on, because I could just talk about the map side of this all day. But curious if you guys are using any, and I'm not sure if this is a brand name or but like story maps, and how to like build, publicly interactive maps that show like, I'm a kid at this school and I use this playground and this is where it's hard for me to get there, or like really getting those crowdsourced information onto a digital map platform. I've seen that in various settings. So just curious if that's on y'all's radar, or if it's something different that you're doing.
At least in my class, we hadn't really considered doing that, but I think that's a great idea and definitely something we could factor in, kind of getting their feedback in that sense. We did a lot of hand filled out surveys when we were in that course, but we're definitely open to changing that up and making that system a little bit more efficient and personal.
Yeah, that might be
I'll chime in, because I'm not sure if Rosie's class did this. Much of our previous work occurred during the pandemic years, so there were some limitations in our direct interaction with all community members. But we did go out to several of our communities with the designs that we hung up on walls, and had community members go around and make comments and feedback, where they could place like a sticky note where they were maybe had a suggestion or experiencing challenges, and we talked about other ways that they could do that. The counties that we've worked in previously are very rural, and Wi-Fi and or other connectivity, even cell phone connectivity, is a real big issue. So just want to put that out there.
Yeah, so it definitely have to be tailored to the abilities, technological abilities of wherever we're trying to do it. All right, Michelle, thanks for stopping by, Michelle. All right, who would like to share next?
Hey, this is Liston with Marta. I can talk a little bit about our group.
Thank you. I was going to call on you guys because I wanted to hear what you had to say as we're expanding further and further out from the schools.
Yeah, absolutely. And so, of course, our program is MARTA is a very broad organization, and so a lot of, I guess, the first thing mentioned there, as far as what activities are kind of just general system upgrades and expansion projects. There's a variety of different projects ongoing, and those through the increase in when public transit offers better services, people are more likely to use that, which increases a lot of people that are using public transportation, which is a lot more of an active trip and correlated with healthier outcomes and physical activity. But my specific team is focused on the Safe Routes to Transit project, which this is a project kind of centered around improving the locations around our bus stops. And we have a lot of different bus stops in the system, but kind of went through different analysis to determine which locations are would have the highest value to offer improvements, be it sidewalk connectivity or crossing or things of that nature. And so any of the locations are within our jurisdiction, which is Clayton County, DeKalb County, and Fulton County. So as far as how we're kind of looking to measure these things, there's kind of a variety of different factors, but a lot of it's trying to connect different points of interest, or such as apartment complexes or grocery stores, things that are generating trips, and ensuring that there is a safe and nice connection between the transit stop and those locations, so that people, because people are more likely to use public transportation when they feel safe and they feel comfortable actually traveling to the bus stop location. So that's kind of a big focus of the project.
Awesome. Great. Thanks for sharing that. And I'm curious, and again, this is another piece that's close to my heart that I could geek out on all day of MARTA and physical activity, but specifically, so you work in Clayton, DeKalb, and Fulton, and those are on our radar as high need areas in terms of obesity prevention. So we're over the years likely to be doing things there where you guys are located. But since this is statewide, I'm thinking, at least in Macon area, Savannah, Chatham County, other places that don't have full rail, as robust of a transit system as MARTA, but do have bus stops. I know when we talked in our other meeting about the bus stop design, like how much do you guys work with other Georgia transit agencies that all have bus stops? Because I think that's a place where what MARTA does could be transferable to other parts of the state, whereas train station design is not really going to be useful for folks in Macon. But just curious if you guys collaborate with other transit agencies.
Yeah, absolutely. And I think that is, a really great, that's something that I love about public transportation, is it is a very collaborative environment. And so, in fact, a big benefit too is that we've been coordinating with Ron, who I believe is also in this meeting with GDOT. So there's been a lot of coordination between GDOT and MARTA on this project, because a lot of our MARTA bus stops are on GDOT infrastructure. And so I think from MARTA's standpoint, and we are hoping to kind of, present and kind of really kind of improve and develop like a good method for how, transit in Georgia, both from like a design standpoint, what types of crossings, what, designs work, but then also from a coordination standpoint, how can we work well with, state agencies? How can we work well with local jurisdictions, such as, different cities or county governments? And I think that kind of wealth of knowledge from this project will be very beneficial to, be it Macon Transit or, Savannah or all the other Georgia cities and towns that have their own transit system.
Awesome. That's great. Thanks. I'm so glad, MARTA, that you guys made it to join us today, because I always feel like MARTA gets talked about a lot and is rarely in the room. So I'm glad you guys are in the room today, and hope you stay with us and we figure out how to continue collaborating. And I'm curious if Ron, if you're on and are willing to go next from the state level transportation perspective. No, maybe he has stepped away. All right, who would like to share next? How about somebody from American Heart Association? Yeah.
Hi, yeah. Elnora Goodlie from the American Heart Association. So our work with the physical activity component is very localized. So it's within Metro Atlanta and more specifically focused on the Carver cluster. So it's Carver cluster because that was identified through data and also through collaboration with APS. And that was the cluster that they said needed the most help. So with this work, we are utilizing the collective impact model, where we work with other community partners, residents in the area, stakeholders, to address physical activity needs and also nutrition security for this work. And we predominantly work in schools, community centers, like faith-based orgs, and our population of focus are youth, so elementary to middle school. And basically, we work with local community partners to support activities that help increase physical activities outside of school. So this was decided based on community feedback and also from school staff, so PE teachers, as there are resources available for during school. And then also through feedback from Health Empowers, we are collaborating with another community partner to where we gather middle school youth, where they have formed a youth advisory team from the cluster. And they are in the process of exploring local businesses that provide physical activities available for them and their families. And yeah, so how do we measure? So we are in the early stages, but the way that we'll be measuring success is through the number of families reporting increase of physical activity outside of schools.
Right. That's awesome. And that's for myself, but others might not know. The Carver cluster, is that Southeast Atlanta?
Southwest area.
West.
Right, the South. So it's okay, I'm not good with, right. Yeah, it's the cluster. Well, so Carver High School, Price Middle School, Sylvan Hills Middle School.
Yeah. Okay. Great. So very hyper local, but still lots to do just in that one cluster, which I think speaks to what we've heard from others who are working more squarely in the education system. And I think you can see how that system boundary aspect is going to become very, very real when we start to figure out how to collaborate. You know, what school systems, what state systems, what neighborhood systems are interconnected, and where is the overlap that we can best align all our work going forward, because we're all doing, or what I've heard so far, and I trust everybody else is too, is just amazing things going on. And what we want to figure out is how can we really stack all these things on top of each other to facilitate that collective impact in a real sense, not just a technical sense. So thank you for sharing. And in the interest of time, I'm just going to go down the list and ask Children's Healthcare if anybody's still on from CHOA that would like to share.
Hey, I'm Lauren. I'm an exercise physiologist at Children's Healthcare of Atlanta's Strong for Life, and we're the prevention arm at Children's. So our mission is really to help families raise healthy, safe, resilient kids in places kids live, learn, and play. And physical activity wise, we have a physical activity training for our early care professionals. This is for infants, toddlers, and preschoolers, really focusing on what does physical activity look like in the classroom. We have a program called the Challenge Program that is in Metro Atlanta. About 50 schools each year receive this program, and it's a school-wide program for the students, the teachers, the staff, as well as the school nutrition team. And this is a program where we promote all 4 of our healthy habits, but most importantly, physical activity. And we kick off each year with a fun pep rally that gets the kids moving, get them excited to participate in healthy habits. Camp Strong for Life, I have the pleasure of directing of, and this camp is for kiddos 8 to 12 years old with a BMI greater than the 85th percentile. So really an intervention program. In addition to our 8 other children's camps, we go out to Camp Twin Lakes in Rutledge, Georgia. We have the kiddos participate in all sorts of camp activities: rock climbing, canoeing, kayaking. Archery is a big hit. There's a farm where they get to learn how to grow plants, crafts, you name it. But in addition to all those fun traditional camp activities, we talk a lot about physical activity and nutrition and even resilience, and the importance of those healthy habits to practice in their daily lives. We do a big training with their parents or caregiver as well, because we know that these kiddos can't make all the choices on their own. They need a lot of help and guidance from their families. So before we go out to camp, the families come to an orientation here in Brookhaven. We talk about physical activity and ways to promote physical activity in the home, in addition to nutrition and resilience. And Fit Together Gwinnett is a very similar model to camp. It serves kids 7 to 11 years old with a BMI greater than the 85th percentile. Right now, we're working with Gwinnett Pediatrics in this program, and this is where Gwinnett Peds can refer any patient that qualifies to our program at Rhodes Jordan Park in Gwinnett County, and we spend an hour and a half playing games. So indoor games, silly games that you do at camp. When the weather gets nicer, we're so excited to utilize the facilities at the park to teach not just the kids, but their family members. A parent or guardian is required to participate in the activities with them for this hour and a half. And they're just moving their bodies and they're learning how to be active in a fun way. Their families are learning to be silly and play traditional games with their kiddos as well. And the hope and goal is that they are participating in this program that's within their community. We've connected a provider's office directly with a community program so that that family has a free resource that they can go to on Tuesday nights, Thursday nights, Saturday afternoons. And hey, if it's not a scheduled session, maybe they go to that community center and they're active together as a family. So that's something new that we launched in January that we've been so excited about, and we're hoping it's successful. We're already seeing great anecdotes from the families and from the providers, because we want to bring programs like this to lots of other counties in Georgia to help tackle overweight and obesity.
Yeah.
Let's see what else. We do have a partnership with Georgia After School Network, talking to their professionals on the importance of physical activity in out of school time programs. So the learning doesn't stop at school. We want to continue to learn, but also to move our bodies outside of those school settings. That's a broad overview of the programs we do. And we typically stick to Metro Atlanta. We do have a push to look into rural communities. There is a strategy that Children's has that's way higher than me that they're trying to figure out how can we bring more of our resources to rural Georgia, and not just Metro Georgia. But like I said, with those programs, we're in Parks and Recs, not only the programs, but also signage, promoting movement, promoting resilience as well. We're in schools, early care centers, and elementary schools. We're not in middle or high schools as far as physical activity goes, hopefully one day. And then Camp Twin Lakes and other camp organizations. Our audience is newborn to about middle school age and their families and any caregiver in their life. So not just the immediate family, but those teachers, their clinicians that they see every so often, and things like that. And we measure success by quantitative feedback and qualitative feedback. We look at how many trainings we host each year and what the demand is for physical activity trainings. We look at how many people attend. We have pre and post evaluations. And we also have a lot of physical activity content on our website that we are looking to add more to. So
that's great. That's a great stack of things you're doing. And I got a couple questions of one's about kind of the messaging around obesity and extra weight and physical activity versus exercise. So that's the second question. First question though, so you're reaching a lot of folks. It seems pretty involved with the parents and the families. So I'm curious, in the places that you have worked, is there a particularly hard to reach demographic or a group that you're just like, oh, I would love it if we had X types of families come in and participate? Is there a gap in terms of reach that you'd like to fill? And maybe that could be part of what we help figure out broadly here.
Yeah, our team definitely is used to the elementary school and middle school aged families, but we would love to do more with ECE families. We do a lot of trainings, and we come to a lot of ECE centers, but we're talking to the teachers. And I know there's been a lot of talk of, oh, I wish we could do a parent training for these kids too.
Right. And then the question, just because this came up on another project that Margaret and I work on, just the messaging around obesity, fat, extra weight, exercise versus PA, you're using movement. I was just hearing you use a lot of the other words. So I'm curious if you just have a quick sort of thought or statement on how do you message this in a way that's not demoralizing to folks carrying extra weight, that we want to have move more, not lift weights and do push-ups, but just get out and move.
Absolutely. Just like that. We don't want to say that we're moving because we want to lose weight. And I know as adults, we talk about that a lot. It's how we were raised, it's how our society speaks. So when we say it, our kids pick up on it. But we want to move because of the good things it does for our body. It boosts our brain power. It helps us perform better in the classroom. It most importantly makes us feel so good. And we want to talk about those reasons why we are moving our bodies. And I stick to words like physical activity and movement and fun and play with the younger kiddos, elementary and ECE. But once we hit middle school and high school, exercise could be appropriate, but exercise is completely different than just moving our bodies. It's designed, it's formatted, it's planned, it's repetitions and sets. And we don't expect, I mean, really up until high school, kids and teens, they don't have to quote unquote exercise. They just need to move in a way that's fun for them and enjoyable.
Yeah. Thanks for that. It's a little bit of a tangent, but I think it's relevant here. And maybe some of the folks on here that aren't as steeped in the physical activity promotion world might not be aware of that. And even though these grants are called obesity and stuff, that's what they're called. Obesity is a health condition, but we talk about it differently when we're talking to communities and folks that we don't want to be put off by that. And that in the other project I was referencing, it came up in the idea what you were getting at is just like pushing back on the diet culture. Like we're not pushing against obesity because we want people to go on a binge diet of some sort. It's because we want healthy movement. We want healthy diets generally as part of really the big culture change towards more movement and healthier diets broadly. But just wanted to get a little bit of that content in here today, as you were using those words in the right way.
Absolutely.
Thank you for that. All right, Community Sprouts, go grow in Biro. Are you still on? I think this was Michelle that had to jump off. We're going once for Community Sprouts. Twice. All right. G Dot, where did you go? Karani, with us?
Yes.
Awesome.
Please. 1 sec, I am multitasking, so.
No worries. Tell us what G Dot's up to.
All right. One thing to note was there were 2 lines here, Georgia Safe Routes to School and Georgia Department of Transportation. One and the same thing. The Safe Routes to School program is just a program underneath the Georgia Department of Transportation, focused on educational initiatives primarily. So I tried to give some references to our design policies related to active transportation. We have complete streets warrants and guidelines. So whenever we touch a road, meets these warrants, we have to accommodate pedestrian and bicycle facilities. And that relates to any project, not just my program and the safety group. Then we have our pedestrian and streetscape guide that we actively try to show other designers and local governments across the state related to how to design roadways safe for active transportation. We will be updating both these guides soon because one thing coming up is our rural active transportation plan, where a key component of that is to update these guidelines. And of course, a plan will be developed as part of that. We're focusing on rural facilities first. Urban will be coming next. Then we have our vulnerable roadway user safety assessment. A lot of the key terms in traffic safety right now, vulnerable roadway user means pedestrian and bicycle. We know that about 20% of our roadway fatalities in Georgia are related to vulnerable roadway users. We're really emphasizing that because they're subject to more kinetic energy than those in vehicles. So though they're only 1% of our crash data, whenever a crash happens, it is often very severe, or only the reported ones are severe. Often people get hit and aren't reporting those kinds of crashes, unfortunately. What other resources we have are our quick build guide, how local communities can reference quick designs that accommodate traffic calming to slow vehicles down and encourage active transportation. We have a great partnership. I know Marta already talked about it, but with Marta on our systemic transit stop crossings, I think we call it Safe Routes Transit. We call it a little bit different, but same project. Ours is just statewide. Marta's been our key partner right now. We really do work statewide, but try to be context sensitive. So each of these design guides vary per regions in the state. And data we assess is mainly related to safety. That's kind of safety first is how we focus on this, but that doesn't mean there aren't unintentional outcomes of healthy and active transportation. But right now, and one key thing to note that I think you guys would be interested in is how we utilize the CDC Social Vulnerability Index to kind of prioritize our projects and make sure we're doing things equitably. We did a study found that all those subcategories of the Social Vulnerability Index relate to higher amounts of pedestrian crashes and crash rates. So we're really trying to hone in on those areas. That's one of our focus areas. That transportation subcategory, I think it's related to lack of access to transportation and demographic data. To a vehicle ownership often has more pedestrian crashes, and that's where we're focusing a lot of our initiatives on, so we can ensure we do things equitably.
Right. Really looking forward to digging into some of your work and seeing where it overlaps. Couple notes for me that you notice he was saying crashes, not accidents, and that's in the active transportation world. If you're not familiar, when you call things accidents, that's just how we talk about them. It implies that, well, they were just going to happen anyway. It's okay. But it really is. The system is designed that crashes and injuries, be it car, pedestrian, or otherwise, the system's designed that those are okay to have. So I learned years ago working in this world that to shift to just call them crashes gives it more weight. It's not like, whoops, there was an accident that killed 7 people on the highway this morning. No, that was a crash. And we need to talk about it as what it is. So that spurs more emotion to design the system in a way that prevents those. And there's some, and I'm not sure how much GDOT and other, I think City of Atlanta is doing, but there's a move now towards this Vision Zero idea that no pedestrian crashes are okay. Like we want to get to zero, and that is possible, but that's a mind, and this will come up in part 2 again, but sort of the mindset on the system that no crashes are okay. Calling them accidents kind of makes it like, whoops, rather than, oh no, this happened and we need to work against that. So I just wanted to raise that as another kind of language thing going on. And Ron, I want to, before I ask the other folks, want to make sure. So you guys, your work is on state routes, and those are typically the roads that have the signs with the little state of Georgia and a number in them. And that's the universe of roadways you guys focus on, right?
No. So not my program, at least. GDOT as a whole, I would say yes. My program is federally funded. So we are able
on local streets too.
On the local streets. I will say this though, if we are being data driven, which we're required to, the state routes have the most fatalities on them, and that has to do with them being arterials. But that doesn't mean we can't help out on local routes at all.
Awesome. That's good too, because I was going to say to all the folks out here, think about how many of the schools, how many of these rec centers, how many of these parks, how many of these ECE sites are located on busy state thoroughfares. So those are the main ones, but Ron's program can help you when you're off of that main road too, which I think is where we find a lot of the problem. You got to travel on that busy road to then turn off onto the side road to get to the school in the neighborhood. And so there's options to work there together. And Ron, you had a question in the chat from Rosie. How do you determine where to implement those complete streets? Is that through the social vulnerability?
It's a long story. I will reference you to a vulnerable roadway user safety assessment. In that link I provided, it's the first link thing to pop up there. You really can get a great picture on how we're prioritizing projects. But it's all very data driven based on crash data and proactively assessing safety. One thing we know about pedestrian crashes is how they're random and rare events at a certain location, though there are a high percentage of all roadway fatalities. The occurrence of a crash at an individual location is rare. So we try to be very proactive with it as well. And that involves a lot of data science as well to predict crashes too, based on demographic data, the surrounding facilities, ridership of a bus stop, things like that. I hope that helped answer your questions, and that demographic data, social availability is
definitely
probably one of the biggest ones we look at.
Thanks so much for being here and being involved today. And checking the time, we got about 20 minutes left, and I only have a few more folks. So just keep going down the list. Georgia DPH, anything you guys want to share if you're on?
Sorry, I was getting myself off of mute. Hi, this is Maria Fontanelle, and I am with DPH, but specifically with chronic disease prevention. So not representing all of DPH, the chronic disease prevention section. And we are funding all of the health districts. Georgia has 18 of them, cluster of the 159 counties. One health district has about 16 counties. That's Waycross, and there's the Metro Atlanta. We are using the Active People Healthy Nation CDC sponsored campaign. Specifically, we are using the Move Your Way to do a population-based event around the state. Districts are working with their PIOs to inform and educate around physical activity, nutrition, working with parks and recs, for local farmers, and all allies to help further nutrition and physical activity around the state. That's kind of a nutshell.
Yeah, it's hard to give so much in one little nutshell, but I would ask you, how do you measure success? Like from your view with chronic disease work, what does success look like in as simplified way as you can share it?
In a simplified way, working with work sites to help them build policies around healthy eating and physical activity. Also working with parks and recs to put signages up, how many partners are really brought to the table to help further nutrition work and physical activity work. Yeah.
Yeah, so getting out there, getting the partners, having the partnerships is the success. That sounds like great. And I'm not sure I know this acronym. GAHPERD, GAHPERD. Who is that? Are you on here?
Georgia Aford. Hey, how you doing?
Hi.
My name's Adam Mullis. I'm a health and physical education teacher, and I'm also a part of the Georgia Association for Health, Physical Education, Recreation, and Dance. That's a lot of words.
I would not have guessed that. I'm glad you were on.
Yeah. I'm the vice president of physical education, and we mainly work with health and physical education teachers in related fields about best practice and a little bit of advocacy at the state level for health and physical education teachers. We have 3 conferences a year. We have one in Athens. We have one near the beach in Georgia called Share the Well. And then we have a summer institute. So we probably have a conference, probably 600-700 PE and health teachers who are getting conferences on best practice. Of course, we try to work with school districts about health and physical education, providing documents about what quality health and PE looks like. And that's a little bit about what we do.
Awesome. Thank you. So we're back in the school setting, specific types of educators in this space. I imagine some of the messaging conversation is directly relevant here, as well as implementing these types of practices and systems within schools, including policies, but it doesn't necessarily have to be policy. It can be like, see, now I'm getting everybody mixed up. What folks were describing earlier about giving the tools and allowing them to use them in the way that best suits the classroom, rather than saying like, you must do this. So sounds like another great group of folks that we want to be sure we're connected with. And forgive me for picking up the pace a little bit, but I want to make sure we give everybody a chance to share that's still on. So Georgia Alliance of YMCAs, are you still with us and would like to share? YMCA's. Hearing none. All right. How about UGA Snap Ed? I saw somebody had that in their signature. Emily Simpson, are you out there? I see you coming on and off mute. Are you having technical difficulties? Yes, so sorry. That is okay. It happens to the best of us. These machines don't always work with us. So give you a second, but you can see there just another great space where folks are working to get activity and nutrition information in front of folks in specific counties. Looking here at Senior Center, so that's a group I don't think we've heard about yet. Thinking about the other side of the lifespan, the older adults, and how are they engaging with this type of work. And I think particularly when we're thinking about the community design stuff, I don't know if folks are familiar with the 880s cities concept, and the idea is if you make a space navigable and useful for an 8-year-old and an 80-year-old, you're likely to catch everybody in between and really have that inclusive space that people can work and engage in. But did we miss anybody that's still on the call that can speak up that didn't share? Would you like to share, or anybody want to react to what we've talked through? Go ahead and stop sharing. Anybody? Okay. Well, stuff go. So what we are moving forward with is we're going to take this map that we created together. We're going to sort of process it, listen to the recording of this meeting, maybe fill out some more details in there, and then we're going to use that whole system map as the basis for our discussion using the iceberg and other kind of frames on March 19th at 10:30 to 12:30 will be the part 2 of this meeting. So I think somebody said, want it to stick. So this is where it sticks. This is where we take what you provided with us today, move it into this other sort of tool to keep thinking about how do we find that alignment? How do we find those synergy points within the system where we're all working together? And then how does that inform our action going forward? And that's what we'll get to in the April session. So we appreciate you being along with us on the journey, and appreciate your patience as we are still on that journey and figuring out our final destination. We know the headline of what we're trying to get to from CDC and our various awards, but we know just from this call, I'm just so impressed with all the different ways folks here are promoting physical activity. And so we want to honor that and make sure that we're working together and complementing each other and not unnecessarily in conflict or competition. So that's sort of the broad stroke of where we're going. This is the last of the part 1 meetings. So now we've had all 4. Our team is going to compile and start sending out meeting notes, the recordings, the slides. Margaret, if you're out there, you could go ahead and drop the PDF of the slides in the chat. They should be in our folder if you haven't already. But we'll send everything out in a nice pack for everybody to have for reference, have to look at. We'll hopefully have more information in there about what the next steps are in terms of these collaborative action teams meeting again before April, what that actually looks like. Like I said earlier, we're not having anybody commit yet to fully being on this for the long term. We're trying to get as many voices here at the beginning that we can as we narrow down to what these action teams are going to look like going forward. And we hope that they sustain as essentially working groups for the state around, in this case, physical activity promotion. But we have our specific needs for that within our grant. I know the Hop and Reach folks, we want to be sure we're overlapping and collaborating as best we can. And everybody else, we want you to be a part of the conversation too, because this affects your work and is your work as well. So that's where we're going and what we're doing. Jennifer, Christina, anything to add that I might have missed here at the end? Nope.
No, you covered it.
All right. Well, great. Well, thank you so much, everybody. And I'll ask Jennifer, Ken, GHPC folks stay on for a quick debrief afterwards. But otherwise, we will wrap up here at 3:20, 10 minutes early, and enjoy the rest of your day. And we look forward to seeing you again in a month.